Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. This is a webinar where we talk about Lyme disease, and we learn about Lyme disease. You ask questions, and I try to provide answers. I hope you get benefit from them, and I think that many people do, and that's why we got a lot of people showing up coming back again and again. To those of you that are back here again, I see many familiar names on my participating list over here, and I'm glad to have you here. To those of you that are new, the way that you work with this webinar is you help create it. And you can participate in two ways. One is write questions, and you can do that by typing in a chat box over here on the lower part of the right-hand side. There's a chat box on the bottom of the screen, I should say, over there. Write your question to me. The only thing I ask is write brief questions. If they start getting too long, they may be too long for me to display. And actually, long questions get difficult to read here in a way that everyone can understand them. So I reserve the right, if there are a particularly long question, not to read them. So just be aware of that, okay? So try to make these more brief questions. That's what works best in this kind of a format. I am doing a recording of tonight's webinar. Tomorrow morning, you'll get an email from me somewhere around 9:30 a.m. Pacific Standard Time, Seattle time, saying that recording is ready. It'll include information about how to sign up for the next series of webinars also, and also where you can go to watch the video. Now, if you happen to miss that email, you can find the recording on the webinars page at treatlyme.net. That's my Lyme disease information site. You can also find them on the homepage of martyrossmd.com, which is my clinic website, and you can find it at my supplement store, Marty Ross MD Supplements, on the homepage as well too. So there's many places you can find it. And then I do post it up on my Facebook page, which is at facebook.com/treatlyme. That I also put it up somewhere around 9:30 a.m. in the morning as well too. Okay. So I just want to let everyone know, I just got back from a conference last week, or actually this week, last week and this week, hosted by a group called the Institute for Functional Medicine. And I've got some new insights on things related to inflammation. And so you may hear from about some of those tonight. But the one thing I did, I got a cold while I was there. I got knocked on my back pretty flat, actually. I had to limit my participation for a few days, and so you may still hear it in me. And I'm going to see how long my voice holds up tonight. I'm hoping I can go the whole hour and a half, but we'll see. I'll make a determination later on as to how I'm holding up. I'm still kind of recovering from it. So anyhow, with that being said, let's go and get started. We'll take a first question here. Hello, Kara. Let's see. Are Thorne and Research Nutritional's artemesinin equally good? Can you please explain artemesinin's mechanism of action in relation to iron? Should one eat iron-rich foods while on artemesinin? Any side effects for long-term use? Okay, so in terms of, I didn't know that Thorne had an artemesinin product, so I can't comment. The products I use for artemesinin are either Research Nutritionals, or I use an artemesinin by a company called Allergy Research. And of those two, I think they're pretty interchangeable, okay? But I can't comment about a specific Thorne product because I haven't been using it, okay? And then in terms of artemesinin and its relationship to iron, so artemesinin interacts with iron, creating what are known as free radicals or oxidizing agents, okay? So free radicals and oxidizing agents damage germs, all right? Now, it does not mean that you need to be on more iron. As I said, it interacts with. I did not say it binds it up or uses it or consumes it. Okay, so there's no consumption of iron. It's just that it is an interaction or a reaction, I should say. Okay, so you do not need to take to emphasize foods with iron or to supplement iron when you're using artemesinin as an herb to treat your Babesia. Okay, all right. In terms of side effects on the artemesinin, generally, I don't find any long-term side effects. Just be aware that when you are using it, it sometimes can lead to a worsening of some of those Babesia symptoms. So while you're killing the Babesia, sometimes you'll get a killing reaction that can give you a slight worsening of some of those Babesia symptoms, primarily the air hunger, primarily the fatigue. Sometimes the sweats will get a little bit worse too. For those of you that are not familiar with artemesinin, let me just talk about it briefly. So there's two herbs that I like to use to treat the co-infection called Babesia. One is an herb called cryptolepis, and the other is artemesinin. Artemesinin comes to us from the world of malaria, as actually do all of our Babesia treatments. Most of our Babesia agents that we're using are things that we would use to treat malaria. And the relationship is Babesia is a parasite that lives inside your red blood cells, which is the same thing malaria does. And malaria is a parasite too that lives in your red blood cells. So we happen to find that using the same agents we use to treat malaria work on Babesia. Now, artemesinin is a Chinese herb. It's also known as Chinese wormwood. It is recognized by the World Health Organization as one of the frontline treatments for malaria, and therefore we can use it also therefore with some success in treating Babesia. The one thing I want to let you know is it seems that I know that Buehner, as in Buehner herbs, and some of my colleagues on the East Coast of the United States are not using as much artemisinin anymore. They don't feel it's working as well. Out here on the West Coast of the United States, I'm still finding good results using artemisinin. And I believe when I treat people from the middle of the country here and also from places around the world, I'm still seeing it work. Even in the UK, even in Europe, in Australia, I have people that are using something called artesunate, which is a derivative of wormwood, that we're still seeing success. It seems to be on the East Coast of the United States, it may not be working as well, okay? The way I like using artemisinin is it comes as a 100 milligram pill. I usually have adults start at 2 of the 100 milligram pills 3 times a day, and they take them for 3 days in a row, and then you stop it for 11 days. And then if you tolerate that well and it doesn't knock you down, then the next round, the way you do it is you go up to 3 pills 3 times a day for 3 days on, then 11 days off. And again, if you didn't get down too much, then you go to 4 pills of the 100 milligram pills 3 times a day for 3 days on, 11 days off. And if you can work up to 500 milligrams 3 times a day for 3 days in a row, 11 days off, I find the most success with that, okay? The thing about when you do artemisinin that way, and the reason we do it that way, is that the liver develops an enzyme that can in part deactivate the artemisinin. So in the days that you're off, that goes away. Also, there seems to be some resistance that even the Babesia can develop when you use it continuously that does not seem to happen when you use it at these high doses for 3 days and then you take the 11 days off, okay? So it's just how I find it to be most successful. I usually these days like to also combine it with cryptolepis, which is a West African herb, and I like using the cryptolepis at 5 milliliters 3 times a day, okay? All right. And both of those, the artemisinin as well as cryptolepis, you can find at Marty Ross MD supplements if you're looking for a source for both of those. Let me show you an article that you can take a look at if you're wondering how to use them. I wrote it down. I mean, I just described it, but I wrote it down too. And let me show you that so you can take a look at it later. Okay. All right. So let's do a screen share here. All right, so this is Treat Lyme by Marty Ross MD. This is my Lyme disease education site. Take a look at the infection treatment plans area here in my online treatment guide. And you want to look for the article that says Kills Babesia, a brief guide. And in here, I lay out various prescription and herbal options. You will find the herbal options in what I call tier 2 treatments. Okay, so there's my artemisinin right there. And then there is the cryptolepis that I like using there too. Okay. All right. So this is a question from Marina. Marina says, can you talk about the FL 1953 Protomyxoa rheumatica and what it is and its treatments? All right. So this Protomyxoa rheumatica is a germ that was identified by Dr. Fry. Fry is a physician that was down in Arizona and came up with this idea that people may have this Protomyxoa living in them, and that it might be the reason that they have a lot of Lyme-like illness and therefore could mimic Lyme. To be honest with you, the treatments that Dr. Fry used in his theory about this are ones that would treat Lyme and treat Babesia. And so a lot of his patients got well when he treated them using the same things we would use to treat Lyme and Babesia. My own impression of Protomyxoa is that it is not, it is probably a germ that can live in healthy people, and that it is a bystander that he happened to have identified, but I don't give any real value to it. And when I see that it has been there, when people bring in labs, I never address it and people get well. I did used to try to address it and really didn't. The things I was addressing would still be to use to treat Bartonella and Lyme and Babesia. And I think the real reason people are getting better is we are actually treating their true infections. All right. So I don't look at it as a real infection. I admit there may be a germ called Protomyxoa that's there, but I don't think it is one of those that gives us illness. Keep in mind, we live with bacteria in our skin. We also live with various bacteria and parasites and other germs in our bodies that we cohabitate with. Just finding something there does not mean that it is a problem. And it's been my experience in working with the Protomyxoa that it's not a problem. Okay? All right. Thanks for that question. Hello, Eileen. Let's see. Hi, Dr. Ross. Thanks so much for these webinars. Our 14-year-old granddaughter collapsed, passed out after a soccer game while riding in a car, excited about meeting an old friend. She had a seizure while in the emergency room. They kept her overnight. The hospital gave no diagnosis. She had no memory of the game, passing out, or wanting to meet the friend. She has had more instances of dizziness, migraine headaches, fever, general illness. They took her to Mayo Clinic where they tested her for Lyme and said she tested negative and that she has POTS. Since then, she has developed almost allergic reactions to some foods, and many things give her headaches and migraines. She has been back to Mayo several times and then just give her other meds, still say it's POTS. What do you think? Thanks again for all you continue to do for us. Glad your clinic is up and running. You're welcome. All right, so POTS, everyone, stands for postural orthostatic tachycardic syndrome, okay? Which means that your heart has episodes where it will race and has a hard time maintaining your blood pressure, all right? And it's probably due to some dysfunction of a nerve called the vagal nerve, which is supposed to control how the heart works and whether you are able to maintain blood pressure, all right? Now, the symptoms, and so sometimes we see POTS as part of Lyme. Lyme can sometimes infect the vagal nerve, giving you this syndrome called POTS. The way that POTS is technically supposed to be diagnosed is we do something, a cardiologist will do a type of test called a tilt table test, where you are tilted up and down, and then we measure what happens with your heart rate as well as your blood pressure. And if there's enough changes in the heart rate and the blood pressure, we call that POTS, okay? All right, now, these other symptoms that you're having, the migraine, headaches, fever, wait a minute here. Oh, I'm sorry, the allergic type reactions to some foods that also get, and foods giving her headaches and migraines also could be something more than POTS. That could be something related to something we call mast cell activation syndrome. And mast cell activation syndrome, and I can't say for sure whether she does, okay, but just briefly on what you've written here, I would wonder, is there a component of mast cell activation syndrome? Because what happens is there's a type of cell called a mast cell, and inside mast cells are where histamines are made. If we are allergic to something and it lands on a mast cell, it causes the mast cell to release its histamines. And those histamines getting released can sometimes trigger allergic-like reaction, like runny nose, maybe hives, but sometimes it can give you a lot of headaches as well, too. And you can, all right, so that's one thing that happens, all right? The other thing we're starting to know about mast cells is we traditionally used to think of them as the allergy cell. They would only get activated by things you were allergic to. We now know differently than that. We now know that things like toxins can turn them on to more easily release their histamines. We know that chronic infection like Lyme can turn them on to more easily release their histamines, okay? So and stress is a big factor that can turn on mast cells to get them to release their histamines. So when I see a picture where somebody is starting to get increasing reactions to foods and allergies and maybe even their environment, I question if they might have this thing called mast cell activation syndrome as part of it too. Okay. Now there's a whole article that I'll show you that you can read. The blood testing is not perfect, and therefore most of us make a decision to treat for mast cell activation based on what the symptoms tell us. Okay. So I'm going to show you that article that you can read to get more detailed information about it too. All right. But I would wonder about possible mast cell activation as part of this. Okay. Let me go ahead and do a quick screen share here. All right, so let's see here. Okay, so this is my article. It's called Mast Cell Activation Syndrome in Lyme. If you're looking at where you can find it, it's in my online Lyme guide, and you can find it in the immune system chapter, okay? But read through here. I talk about the things that turn on those mast cells, and then I talk about the kind of symptoms you might get, okay? And then I talk also about that the testing isn't good, and I talk about the treatment approach that you can use. So take a look at this article, all right? Oh, there we go. All right, got it. All right. So thanks for that question, and good luck to you. Or I should say good luck to your granddaughter, that is. Gail, I'm sorry about that question, even though you tried to shorten it, is a monster question. I can't answer a length of a question like this in this kind of a format, okay? So I'm sorry about that. Yep. Hello, Karen. Let's see. Hello, Dr. Ross. Thank you for taking my question. I have Bartonella, struggling with intense nausea some days, vomiting, can't take many of my pills. Taking Bactrim, minocycline, no pulsing for 5 weeks now. Both Bactrim and minocycline can cause nausea. Since I can't pulse for Bart, but I could I cut down to 1 pill each per day? What other antibiotics or herbals can I take for Bart that won't cause nausea? Any suggestions to combat nausea? FYI, pills stopped. Curcumin, lipoic, ATP 360, Cytoquel, CoQ10, Ecolonia cava, ashwagandha, and grapefruit seed. Okay, so minocycline and rifampin is a potential way to treat Bartonella. There are others. Minocycline can give nausea, Bactrim can give nausea, and in fact, of the various antibiotics that can give nausea or that we use to treat Bartonella, these two happen to be some of the more nausea-causing ones, okay? So one thing that you might want to try is to first, before you get rid of the Bactrim, you might try to stop the minocycline, just stop it. And see, and while you continue taking the Bactrim, and see if the nausea goes away or gets better. If you've identified that the main culprit then is minocycline, you can substitute another antibiotic. And what you could substitute for minocycline to use along with Bactrim would either be clarithromycin, which is also known as Biaxin, 500 milligrams twice a day, or you could use Zithromax, also known as azithromycin, 500 milligrams one time a day. Okay, those two, either one of those used with Bactrim would tend to probably be less nauseating than the minocycline is, and it could be that maybe it's just the minocycline giving the nausea. Okay, now if you stop both the minocycline and you're just on Bactrim for a number of days and the nausea doesn't go away, then I would try a trial stopping the Bactrim and see, while you remain off the minocycline, and see, does the nausea go away? Okay. And if it does, then you may want to look at some other prescribing options. All right. So another option you could look at that would tend not to give as much of the nausea would be to substitute minocycline for either azithromycin or clarithromycin. And that Bactrim, you could substitute, possibly try rifampin. Some people do get nausea in rifampin, but not everyone does. I tend to find that Bactrim gives more nausea than rifampin does. Okay, all right. And in terms of the dosing of the rifampin, it's a 300 milligram pill, 2 pills, 1 time a day. All right. Now, the prescription options that I just identified for you will tend to work about 80 to 85% of the time. The other option that would tend to have even less chance of giving nausea would be to go herbal. And for herbal, I like working with something called Sitta acuta and something called Hutania, okay? And Sitta acuta and Hutania are 2 herbs that do work well, but they're going to work about 70 to 75% of the time, okay? So they're not quite as successful as the prescription antibiotics are, but they're still pretty good. The way you work with those, you start at 5 drops of each twice a day, and every day or every other day add 1 drop per dose per day until you reach 30 drops of each twice a day, okay? So those would be some thoughts for you. All right, in terms of herbs that you can use that sometimes help with nausea, one is ginger. Ginger is great for nausea. In fact, I used to use it when I'm a family doctor by training, and so when I was in my training, I used to deliver babies. And one of the things I would use with mothers that were having a lot of time with a hard time with nausea is ginger. Ginger is great for nausea. You can make your own ginger teas. The way you do that, and just get some ginger root, and you chop it into like 1/4 inch round pieces. You don't need to skin it, but 1/4 inch round pieces. Take about a handful, about that good size hand, okay? And you put it into about 2 or 3 cups of boiling water. Boil it for about 10, 15 minutes. Creates a very strong ginger tea. And then what you can do is you just sip on it. You could chill it and put it in the refrigerator, and whenever you have nausea, just sip on it. It can quiet it down. Another thing you can do to help with nausea is to protect your stomach lining. And what is useful to protect the stomach lining is to use licorice. Licorice can be quite helpful. So you would want to use a variety of licorice, which is called deglycerated licorice. And it's basically licorice that has a chemical group removed that may increase your blood pressure. Okay, so it's deglycerated licorice. It'll come in tablets, and you want to chew 2 tablets. Probably in this case, I would chew 2 tablets about 15 minutes before you take your antibiotics. And what happens is spit and the chemicals in the licorice mix together to create a microscopic gelatinous coat that will coat your food pipe and even coat your stomach and give you some protection, okay? So that could be an option for you to look at too, all right? I'm going to do a quick screen share here so I can show you the article you can look at on how you dose the various antibiotic options I gave you, and also dose that Sitta acuta and Hutania too. So let me do that here. All right. So you'd want to take a look at, in my online Lyme guide, take a look at the infection treatment plan section here. And then go down and click on this article called Kills Bartonella, a brief guide. And down here, I describe treatments that are rifampin-based treatments. I describe Bactrim-based treatments. And then I get in this section into describing how to use the Hutania and Sitta acuta that I was talking about, okay? All right. Karen, thank you for that question. Good luck to you. Hello. Let's see. I'm going to say Ariana. I hope I said that correctly. I hope that's the pronunciation you use. Are you familiar with and use genetic testing that shows and uses remedies to treat abnormalities that impact the ability to treat Lyme, Babesia, or Bartonella? Are the tests reliable? All right. So, there is a type of there's genetic testing. Okay, we can do genetic testing, and there's a more common way that people will do their genetic testing is to send a sample into 23andMe, and then 23andMe gives you raw data. And then you take that raw data and you can have it interpreted using an online program like Genetic Genie, for instance, okay? And then you're going to get a report back. And you're going to get a report of a number of things. And some of these can be, will be reports on various detox genes, like something called MTHFR, something called COMT, something called MTR. There's a variety of genes that impact how we can detox, and we have the ability to see whether there might be some defect in those genes, okay? Now, this all gets very complicated because even if you have a genetic defect does not mean you're going to manifest a problem. All right. So even if your code for a genetic defect on one of the detoxing pathways says you've got a defect, it doesn't mean that your body will manifest it. All right. Part of the reason is that we, and actually this is a concept that was discussed this weekend at the conference I was at too. You know, our genetic makeup, or in terms of who we are made up of our own genes. But then if we look at our own genetic material, about 90% is what is found in bacteria in our gut. We have tons of bacteria, viruses, parasites, etc., that live in our gut. And sometimes the metabolisms that they have can make up for the own genetic defects that we have. In other words, they may produce the chemicals we need, or they may take over some of those detox abnormalities that we can't do on our own, and they'll take it over, okay? So even though our genetic profile may have a defect, does not mean our whole body has that defect, because maybe the bacteria and other germs that live in us stand in and take over. It's possible, okay? So these days, for instance, like if somebody has an MTHFR defect, MTHFR stands for methyl-tetrahydrofolate reductase. And what it is, it's an enzyme that is supposed to take diet folate and convert it into an activated methylated form of folate. And you need to have that step occur so that many other detox reactions can occur in the body. And ultimately, you can make a chemical called glutathione. Okay? All right. One way ultimately to find out if that MTHFR defect actually is causing a problem is to see if one of the downstream products that it can, if one of its downstream chemicals in the chemical reaction chain of reactions that happen after you make the methylated folate, you would look downstream and see if something called homocysteine is elevated. If homocysteine is elevated, that means that your body has not adapted to that defect, and you probably should do something about it, okay? But if you have an MTHFR defect and your homocysteine is normal, it means that probably your body and the bacteria that inhabit in your gut and the viruses and everything else that inhabit there are working together to make up for the deficit caused by that genetic defect in you. And you don't have to do anything for it then. So genetic testing does not always tell us exactly what we have to do to correct a problem, because we may already have corrected it, basically. All right. So now I'm just talking about detox. Okay. In terms of abnormalities, in terms of our ability, our immune system's ability to kill Lyme or Babesia or Bartonella, I'm not aware of any specific genetic testing that gives us insights on that. Okay. I am aware of genetic testing, again, that many of my colleagues will use that look at our detox capabilities, but I think we need to refine it even one step further. Instead of just looking at the defect, we need to do measurements of things that show us whether that defect is actually causing a problem or not causing a problem. Have we and our bacteria modified ourselves in a way to overcome it or not? Okay? All right. That's kind of the simple way. Thanks for that question. All right. Hi, Ariana again. Let's see. Is the Buehner protocol good for Lyme, Babesia, and Bartonella? Is it good for neurologic symptoms? All right. So Buehner is a master herbalist that has reviewed a lot of science and has come up with some proposed ways to treat all of these infections. In general, I think it's a very complex regimen to do because he uses an herb for about any kind of defect you might have. If you've looked at his protocol, you'll see it has many things. There are some components of Buehner I do like. I do like that he uses cat's claw to kill Lyme. He combines it with andrographis, and I think there's a better herb to combine it with, which is called otoba bark. I find a cat's claw otoba bark combination to kill Lyme more effective than a combination of cat's claw and andrographis. For Bartonella, Buehner likes to use a combination of the germ killers Sida acuta and Hutinia. I like to use those too, and I think they work 70 to 75% of the time. For Babesia, he likes to use cryptolepis. I use that too. Okay, now, in terms of Buehner versus prescription protocols, Buehner herbally probably works about 70, 75% of the time. I think prescription antibiotic protocols tend to have a better chance of helping, but then you have the risk of doing some injury to the bacteria systems in your gut. Okay, so it's a trade-off. All right. I think a lot of people that try Buehner eventually do have to switch over to prescription antibiotic regimens, unfortunately. All right. Thank you for that question. Hello, Ian. Hold on here just a minute. Have you had many patients that have lesions on the brain and spine? What could cause this, as I have been diagnosed with multiple sclerosis, but believe it is caused by Lyme and co-infections? All right. So multiple sclerosis, everyone, is what I will call a neurologic construct. All right. When you're given a diagnosis of MS, it doesn't tell us what caused it. But what I mean by neurologic construct is we say that you need to have certain lesions in certain places and certain symptoms to say that you have MS. And one of those things you need to have is lesions in the brain in a covering of the nerves called the myelin, okay? And basically, that's fat covering that covers the nerves called myelin goes away. It gets destroyed, and it's no longer there, creating the appearance of lesions on an MRI X-ray, basically, all right? Now, it is possible that a cause of MS is Lyme. It is possible a cause of MS is Bartonella. Those are two germs that also can lead to some demyelination or loss of covering of the nerves, which would give you an appearance of lesions on an MRI, okay? All right, so then you get into kind of, I guess, you got to figure out what you call it. If you think you have Lyme and Bartonella causing these lesions, do you call it MS still? Or do you call it Lyme and Bartonella? Or do you call it Lyme and Bartonella causing MS? Or do you call it MS caused by Lyme and Bartonella? Or do you call it Lyme and Bartonella with MS features? All right. In the end, it doesn't matter. If there is the involvement of Bartonella and of Lyme, I think you should treat for those. The exact mechanism by which they destroy the myelin that covers the nerves is not, I don't know. If we look at the theories about MS, they think the theories of MS is that it's thought to be a component of it is autoimmune, where the immune system will attack the myelin and destroy it. But who knows exactly why this happens for sure. Okay. All right. Thanks, Ian. I wish I had better information for you, but all I can say is something that can give those lesions that they call MS could be Bartonella and Lyme. Okay? All right. Good luck to you. Hello, Burgett. Let's see. I take since 2 years Buehner herbs for chronic Lyme infection. Developed recently a large floater in the left eye and seeing flashing lights in the dark. Started to drink more green tea and taking extra buffered vitamin C. Any other supplements you would recommend to reduce the floater? We'll see an eye doctor next week. Unfortunately, I don't have good supplements for floaters. This is something I usually rely upon seeing an eye doctor to see what they think the cause is, and then they can help address that. Okay? All right. Good luck to you. Hello, Cindy. Let's see here. Hold on a minute. I got to take a sip of water again. Okay. Let's see. I was a patient of yours in 2016 and had previously tested positive for Lyme, Babesia decani, Bartonella henselae, Bartonella cantana, human Ehrlichia HHV6, and mycoplasma, and was treated. But my immune system has recently reached a new low, and the most prominent symptoms suggest Bartonella with a difficult respiratory infection that seems to point to the mycoplasma. Is there any antibiotic treatment that would effectively take care of both? Also, I've had troubles with vertical double vision, and all I've read makes that seem atypical, but wondered if this is within the co-infection range or if it crosses over into autoimmune. All right. So about the double vision, that would mean that one of the muscles that's supposed to be pulling the eye in a certain direction is not working correctly. And that could be because the nerve that is supposed to make that muscle pull correctly is not working correctly. Okay. And so it is possible Bartonella can give you those type of neuropathies causing a muscle not to work. It is possible Lyme can too. All right. But of the co-infections, I would look more at Bartonella as a potential cause of that. In terms of treating mycoplasma and of treating Bartonella, we need to use what are known as intracellular antibiotics that get inside of cells and inside of the germs. Okay, all right. And so a combination that could work for both of those could be rifampin that I mentioned earlier tonight. You could couple that rifampin with an azithromycin, or you could couple that rifampin with a clarithromycin, but those could be regimens that would take care of both possibilities of infection. Okay? All right. Good luck to you. Hello, B. Let's see. Dr. Marty, about Morgellons. The shreds are keratin and collagen, and it is considered a filamentous Borrelia dermatitis. Do you know of studies or treatment that addresses Morgellons with disulfiram? Is disulfiram difficult to take or maintain because of the alcohol being a frequent ingredient in toothpaste, hair colorants, deodorant, etc.? What is the length for the course of treatment with antabuse? All right. So everyone, antabuse is disulfiram. So just to make clear that B is talking about the same medication here. Okay. All right. So Morgellons, everyone, is a skin condition that can develop when you have Lyme. People sometimes will get filaments. To be honest, we're not. There's been studies of those filaments, and we have not found actually an infectious agent that is the cause. However, what we do see is in people that have Morgellons and these skin rashes they get with these filaments, is that about 90% or so test positive for Lyme. And if we treat Lyme, often this condition will go away. Okay. We think it probably has something to do with immune alteration or immune suppression related to having Lyme. And it can give you these keratin, collagen fibers. Okay. All right. All right. Now, in terms of studies or what disulfiram is and antabuse, so let me talk about that first, and then I'll try to answer your question about Morgellons. All right. So in Lyme disease, one of the reasons that people may have a hard time getting over the infection is that the germs have the ability to form what are called persister cells or develop persister state. Okay. All right. And so many of you are familiar that Lyme has spirochetes and that Lyme has cysts. Those are the two major we call forms. Okay. Spirochetes, that corkscrew looking thing. Cysts are a microscopic version. All right. It appears, though, based on research that was published about 3 or 4 years ago at a Northeastern university, that when those forms are exposed to antibiotics for some time, some of the spirochetes and some of the cyst will slow their metabolism way down and effectively go into hibernation. Those are called persisters. Okay. All right. So you can have persister spirochetes. You can have persister cyst. Okay. All right. All right. So these persisters basically, because they've gone into hibernation and can ignore all the antibiotics around them. All right. So there's starting to be some research going on. There has been research going on over the last year and a half, 2 years now, in a number of labs looking at what do you do for a persister? If regular antibiotics don't work on them because they ignore regular antibiotics, what things can we throw at a persister that will help the body get rid of it? Okay. And so there's a lab out in Stanford University, and a physician or a PhD named Rohatis that has been working with his lab. And they were using a technique where they could rapidly test Lyme persisters against various chemicals and see if any of those chemicals would kill the persisters. All right. And there's a type of screening technique called high throughput screening. And in fact, what his lab was doing, the Stanford lab was doing, is they were actually looking at anything that was available in the prescription database that could be used to prescribe to treat any condition. And they were trying to see, would it also happen to treat persister Lyme? And they happened to discover that antabuse, this drug that we use to treat alcoholism, happens to have the ability to kill persister Lyme. All right. All right. So the only studies that have been published to date are ones involving was a case study of 3 patients. What case study means we basically take people, we give them a medicine, and we see what happens, and we write about it, and we publish it. Okay. So my colleague, Dr. Buehner, published a study in May involving 3 people. All right. And these were people that had Lyme. He did not specify whether they had Morgellons or not. All right. There have been no other publishings that have been done about what happens with people when we give them disulfiram. Now, I know that Dr. Horowitz, I believe, in New York State has got a series, I think about 100 people now, that he said, I think he may publish on his. And I know that Dr. Fallon out of Columbia University has been trying to get people, I believe, people to enroll in a study, or he has plans to do a study involving disulfiram too. I have not seen anyone do a study, though, looking at whether it helps with Morgellons. I don't have enough experience yet working with it. As many of you know, I just reopened my practice about 2 months ago, so I don't have enough experience yet knowing whether it's going to help with people with Morgellons. But if an underlying cause of Morgellons is Lyme, and if persister Lyme makes it more difficult to get rid of the Lyme that leads to Morgellons, then yeah, maybe using disulfiram could be a reasonable way to helping with the Morgellons as well too. Okay? All right. And then I think you ask, is it difficult to take because of alcohol? The answer, I mean, yeah, you got to remove alcohol from everything. You can't have vinegar, for instance, too. All right. But the thing that probably makes it the most difficult to take is that it can lead to very strong Herxheimer reactions. It can give you very strong reactions, and therefore we have to start low and slow. All right. Standard treatment that many of my colleagues are doing is 4 to 6 months. I'm still undecided if I'm going to limit the length. I'll see as I work with more patients with it as well. Okay. For more detailed information about how you dose it and what you do about side effects, etc., I'm going to steer you towards a video article and small written article that I have about it. So let me do a quick screen share here. All right. Okay, so it's called Is Antabuse Disulfiram the Magic Bullet for Chronic Lyme Disease? If you just write disulfiram in my search bar, you'll find it, okay? And in here is a recording from one of my webinars, and then I talk about dosing, I talk about how you can limit the effects, and I talk about foods specifically to avoid, okay? Anyhow, take a look here for more information, okay? All right. B, thank you for that question. Hello, Jan. Let's see. Have you had success with treating Lyme with a Rife machine? So I'll be glad to answer that. So Rife machines, everyone, is an electromagnetic frequency machine that generates different wavelengths of electromagnetic frequencies. And the idea is that we can find a frequency of these electromagnetic waves that can vibrate and burst a germ, okay? All right, just like if you were to take an opera singer and put them in front of a glass of water and they were to sing and that glass shatters, what they're doing is they're vibrating their voice with the vibrations of the glass, and they get it to vibrate so that it breaks. You, in theory, can do the same thing with a Rife machine. All right. Now, does it work? Well, in my experience, that for people that have tried it, and I've never actually prescribed it, and the reason is that the Food and Drug Administration has come down very hard on doctors that prescribe it. Okay, so I've never prescribed it, but people find about Rife machines and they try them on their own. And what I have seen is about maybe 30 to 40% of people get some benefit. I would never look at it as being a cure. It may give some benefit to your symptoms as a whole. Okay. The thing about in terms of the theory about how it works, it probably can treat spirochetes. It may treat the cyst form of the germ, but it may have a hard time treating what is known as intracellular Lyme. So usually to get the best results, I think you're still probably going to need to be on an antibiotic to treat the intracellular form of the germ. Okay. All right. But again, my experience would say that if people that have come in using it, about 30 to 40% get benefit. Now, the California, what used to be called an organization that was previously called the California Lyme Disease Association, also known as LymeDisease.org, has actually done studies looking at, they're running a program called My Lyme Data. And what My Lyme Data is a basically, they have a bunch of people that have agreed to let information be collected about them whenever My Lyme Data wants to ask a question, okay? And last year they did a study asking people about the successes or non-successes and side effects they had with various alternative medicine treatments, and they published it, okay? And I'm going to show it to you here because I'm going to show you what their results say, all right? So let's see here. Let me do a quick screen share again. All right. So bear with me. I'm going to say My Lyme Data Alternative Medicine. Okay, so this is at LymeDisease.org, My Lyme Data Alternative Lyme Disease Treatment, okay? And this is down here. In terms of Rife machines, they find people that did participate in their study, 35% of them said they had some benefit, okay? Hyperthermia. I know everyone's going to Germany to get their hyperthermia treatments. About 45% of people had some benefit, according to this study. Stem cell therapy. Only about 3% of people in this study had some benefit, okay? So anyhow, this is a place you can kind of get an idea if you're looking at what alternative treatments might be available that could help. You could take a look here, okay? All right. All right. Thank you for the question. Good luck to you. Let's see, I think we answered this one earlier. Yeah, we did. Hello, Geraldine. When deciding about treatment for Lyme, when do you opt for herbal antibiotics as opposed to pharmaceuticals? It's a decision I make with my patients. It's based on their preferences. So what I try to do, so for instance, there's some people that see me that will never let me put an herb in them, even if I recommend it, okay? There are some people that see me that will never let me put a prescription in them. And there's some people that really want to have a good dialogue about what's the best options and why, okay? All right, so as a starting point, I look at what are the success chances that I have seen in my practice using herbal antibiotics versus prescription, all right? So it depends on the germ. So for the Lyme infection, the Lyme germ, I find that the combination of Octoba and cat's claw works 85 to 90% of the time. That is the same success rate that I find in using prescription antibiotics. All right. All right. When it comes to Bartonella, I find that prescription antibiotic combinations for Bartonella will work about 80 to 85% of the time, but the herbal for Bartonella, killing it, works 70 to 75% of the time. For Babesia, the prescription options for getting rid of Babesia work about 80 to 85% of the time. And the Herbal options work about 75 to 80% of the time. All right. So I want my patients to have that information. Now, what's the downside of antibiotics? Well, the downside is that you do some injury to the good bacteria of your intestines. And they're starting to, the whole idea about what happens with your gut microbiome. That's the microbiome, okay? The organisms that live inside of your intestines. There's a lot of them. In fact, 90% of our body's DNA is from the germs living down in our intestinal tract, okay? That's a lot of stuff, okay? And so down there we have viruses, bacteria, fungi, parasites that just live with us. They cohabitate with us. We let them live there because they're doing job for us. They're helping with detox. They're helping modulate our immune system. They're helping digest food. They do a lot of things that microbiome does, all right? And whenever we're on antibiotics, we cause some injury to that. We're starting to get a lot more sense of the importance of the microbiome over time. But one of the things that is starting to look apparent is after antibiotics, it may take 2 or 3 or more years to get complete recovering of your microbiome. That's a lot of time. And there's some authors that wonder if it ever fully recovers again. All right. So yes, by using prescription antibiotics, we may be harming ourselves. However, we have to weigh that against the risk of not treating our germs that are also harming us. All right. So yeah, I admit there's times I use antibiotics with my patients a lot, and I acknowledge I may be injuring the microbiome, but I do that at the potential benefit of getting their Lyme infection under control and all the disaster that's causing, and all the disaster that their Bartonella infection is causing. Okay. So what I want to let you know, it's a very personal decision. People have to make a decision as to what's right for them, and are they willing to take a risk of doing injury to their microbiome by doing prescriptions or not? And are they willing to take a risk of using herbal antibiotics that may not be as effective as prescription antibiotics at getting their Lyme and co-infections under control? Okay, so those are things we have to consider. Now, I will let you know, we do things to support the microbiome. We have people on probiotics. And more these days, I'm also going to start working. I have been adding and will be working and am working more aggressively with diet as a means of having people eat foods that continue to support a healthy microbiome. Those would be basically high fiber foods. That would be healthy vegetables primarily, and various forms of soluble grain, soluble fibers like avocado is good. Some of the beans can be good, but there's foods you can emphasize that are rich in fiber that helps support your microbiome too. Okay, so anyway, we have to kind of consider all these. So so it isn't that I opt for it, it's my patients opt for it, but I have that discussion with them based on what's important to them from their value standpoint. Okay? All right. Good luck to you, Geraldine. Hello, Steve. Hi, Dr. Ross. I have Babesia and suffer from bad sweats even if I walk for 30 minutes. I get wet, so is this good or bad in your opinion? By the way, I am on a disulfiram course 1 month and so far going okay, although the sweats are still an issue. Any thoughts on this? So I know disulfiram in theory, can help with Babesia. I still think we're going to need more than disulfiram for the Babesia. I do think disulfiram can help a lot of people with their persister Lyme, but if we look at Buehner, who I mentioned earlier, was the doctor that published the 3 case reports. He also in Boston at the ILADS meeting a couple months ago basically went through his experience on 31 patients now. And of those 31 reported he was able to get 6 of the 31 into extended remission. Okay. So disulfiram is not going to be the wonder drug for everyone, although it is helping a lot of people. All right. But I think in terms of what it has a greater potential of helping is Lyme. And I think it may help some people with Babesia, but I still think we're going to need to do more to get rid of the Babesia. All right? All right. Good luck to you. Hello, Vicky. Let's see. I have OTA mycotoxin, Via 529 from Great Plains Labs, as well as Lyme, Babesia, and Bartonella. ND wants to treat all at the same time with a combo of antibiotics, herbs, binders, etc. But another one's saying, don't worry about Lyme for now, focus on Lyme, etc. With antibiotics first. What are your thoughts? It's not as simple as that. I wish it was. Um, I would need to know more of your history. So, for instance, if you and I were to sit and talk, and I took a detailed history, and I discovered that you mainly got sick after you were living in a house that had mold toxins that could tell, I would say go after your mold toxins first. If, on the other hand, you told me that you didn't get sick until you got a known tick bite, and it was within 3 months, 6 months later, you got sick, even though you were living in a house of mold, I might say go after your infections first. Okay. So the reason is something ultimately is what tips us over. And if we can identify what it was that tipped us over, that's usually what I'm going to go after first. It just has been what my policy has been. Okay. And I will tell you, for instance, I had a patient that came to see me that had severe cognitive dysfunction, had lost his job, had lost his kids because he was too sick to take care of them, had been told by a Lyme practitioner here in town that he better treat his Lyme with IV antibiotics because he was basically going to lose his mind. He came to see me. Yeah, he had positive Lyme tests, but as I took his history, he got sick when he was living in a house that had black mold growing on the walls, and prior to that had been doing well. So the first thing I did, I went after his mold toxins first, and after about 6 months of detox work, he was 100% well. We never had to do anything to treat his Lyme because his immune system was able to deal with it. Okay. So I usually try to look at what came first. What was the thing that tipped you over, if we can identify that? And that generally is what I'm going to go for first. Okay. All right. Good luck to you, Vicki. All right. Let's see here. Get rid of a couple things here, everyone. Just a minute. Hello, Elizabeth. What do you recommend for treating Lyme arthritis? I just read an article that recommends 30 days of 100 milligrams of Doxy twice a day. What are your thoughts? But the problem is I need to know a lot more. Can Doxy 100 milligrams twice a day for 30 days help with Lyme arthritis? Yes, you can. But and that would be a good treatment that stands an 85% chance of working if you happen to be treating your Lyme within the first 30 days that you got infected. All right. So the reason I can say that is the standard recommendation from the Infectious Disease Society of America and the Centers for Disease Control is to treat Lyme for only 2 weeks to 4 weeks with doxycycline. That's their recommendation. And their old recommendation was 3 to 4 weeks. Their newer recommendation, that's their proposal, is only saying 2 to 4 weeks, depending on some other variables. All right. Anyhow, we know from people using their 30 days of antibiotics that about 80 to 85% will get well and 15 to 20% remain sick. So we know that their doxycycline fails if it's only used for 30 days in about 50 to 20% of people. Okay. If you've had this for longer, I would want to use Doxy for a longer period of time, and I might use some other antibiotics to treat the other forms of Lyme as well too. But as an initial place to start, yeah, Doxy for 30 days could be beneficial, but if you've had this in you for more than a month, you're going to need more than that. And you're probably going to need to combine it with some other things too. All right. So if you want to see how to build a Lyme treatment, let me just do a quick screen share here for you. All right, so take a look in my website, The Treat Lyme by Marty Ross MD. Take a look at my infection treatments plan section here and take a look at this, a Lyme disease antibiotic guide. Okay, and in here, I talk about how do you build a Lyme treatment. Why do you need to use more than doxycycline? Okay, so take a look here. I'm not going to go through the whole thing with you right now, but I actually have even recorded a video that does walk you through it as well too. Okay, all right. All right. Good luck to you, Elizabeth. Hello, Geraldine. Let's see. I'm not clear on how Lyme bacteria cause symptoms. Are they from toxins or other byproducts that the bacteria give off as a consequence of their life cycle or death? For instance, sometimes I have brief tingling or tickling sensations here and there in my skin. How are they caused? All right. So we don't understand everything. Okay, I will just tell you. But I can tell you that it is a common in Lyme that people have wandering pains or wandering neurologic symptoms, like the tingling sensations. Okay. Why do they wander? We don't know. Ultimately, your symptoms in Lyme are caused by inflammation of the body trying to get rid of the germ. Okay? So when your white blood cells see an infection like Lyme, they manufacture a group of chemicals that are called cytokines. Cytokines are good and cytokines are bad. And there's a lot of them, a lot of different kinds. Okay? So on the good side, cytokines cause more white blood cells to be made. They draw those white blood cells to where the infection is. They help those white blood cells attack the germ and work better. But if the immune system doesn't do a good job getting rid of those infections, it'll try harder and harder, and it's going to keep trying harder and harder, and eventually it's going to make too many cytokines. And it's too many cytokines that make it so you can't think, make you hurt all over, give you low energy, etc. They give you the Lyme symptoms, all right? Now, why is it that you might get more inflammation in one spot of the body, giving you more pain and numbness and tingling at one time, and then in another spot at another time? I don't know. I've never seen a decent explanation for why that can happen. Okay? All right. And thank you for that question. Good luck to you. Hello, Diane. Let's see. Is disulfiram a sulfa drug? So shouldn't it be used by someone allergic to sulfa drugs? All right. Um, so there is a chemical called sulfur. Okay, do you hear? I didn't say sulfa, I said sulfur. All right. And sulfur is found in sulfa antibiotics like Bactrim, but it's part of a chemical structure of which one of the components is sulfur mixed with some other chemicals to create a sulfa group. All right. When you're allergic to Bactrim, you're allergic to the the sulfa group, not necessarily the sulfur. All right. Now, disulfiram has sulfur in it and has a structure which is called a disulfide bond, where two sulfur groups are combined together, basically. All right. But it's a different chemical structure than sulfa in sulfa antibiotics. Generally, people that have sulfa antibiotic or sulfa allergies will likely not have a reaction to sulfides. Okay, generally. Sometimes people do. There can be a small amount of cross reaction, okay? But generally that can be managed using antihistamines, all right? So having a sulfa allergy like to Bactrim or Septra, one of those antibiotics, does not rule out being able to use disulfide, because it's a different sulfur structure in the disulfide, all right, in the disulfiram, I mean, okay? All right. All right, let's see. Lisa says, in your Skype consultations, are you able to review symptoms and suggest a clinical diagnosis of Lyme and Bartonella? I have had them previously diagnosed by a former Lyme literate medical doctor. I'd like to discuss current treatment options and strategies, but need to know any limitations you have in discussions before I book with you. I understand you can't write prescriptions unless we meet in person. Thank you. So Lisa, in terms of, so everyone, there's a way that I visit with people online. And these are people that have never seen me in my clinic before. All right. And I call it a limited consult service. I'll show you where you can read more about it and even schedule it if you want to here in a minute. And I don't use Skype to do it because Skype is not private. Microsoft, who owns Skype, can listen in on any time it wants to. I use a different video platform called VC, which is HIPAA and privacy secure. Okay. All right. But anyhow, during the visits, I take your history, I talk with you. I can learn a lot by doing that. The only limitation is I don't get to examine you. So if there's something I can learn by examining you, I don't have that information to feed into the conversation. I do, based on the information I gained from talking with you, have the same kind of discussions I would with somebody who came to see me in office. I can make the same recommendations. It's just that I can't prescribe things. If it requires prescriptions, you'll have to wind up talking to another doctor to prescribe it. And the consult visit is limited by one thing, and that is I don't get to examine you. So there may be some things I happen to miss, although it'd be rare that you really would miss something by not examining a person with Lyme, because most of it is subjective illness. It's the things that you describe that gives me the information I need to treat somebody. Okay? All right. So everyone, if you're interested in doing this, let me just show you where you can learn more about this. All right, so take a look at my clinic, which is at martyrossmd.com, and look at my appointments page. And then this is where I talk about a full medical service or limited consult service. If you scroll all the way down here, option 2 is my limited consult service, where I talk about what goes on in one of these over the internet visits. Okay, I even talk about the charges, and I talk about the limitations. If you do want to schedule it, you just come up here and click the Book Now button, and you should be able to go ahead and schedule it. Okay? All right. All right. Thanks for that question, Lisa. Good luck to you. Hello, Brooke. Let's see. My friend's 17-year-old son has been diagnosed with idiopathic thrombocytopenic purpura. His platelet count is very low. He also has night sweats. Could this be related to Babesia? So idiopathic thrombocytopenic purpura is a condition that causes low platelets. And the reason we call it idiopathic is we don't know what causes it. Okay, anything in medicine that you see, idiopathic high blood pressure or idiopathic thrombocytopenia, it just means we don't have an identified cause. Okay, I have seen one patient in my practice that came to me with ITP that as we treated her Lyme, Bartonella, and Babesia, she no longer had any more problems with it. It did go away because probably in her case, it was probably triggered by one of those infections or even an autoimmune illness triggered by one of those infections. Okay. All right. So it's possible. It is possible. It could be related to Babesia, but there may be other causes for it too. Okay. All right. Thanks for that question. Good luck to you. Or actually, good luck to the 17-year-old son. All right, everyone. I'm starting to fade. So I'm going to need to give my voice a rest here, and I'm going to call it quits for tonight. I'm glad I was able to get this far with you, given how sick I was earlier in the week. But anyhow, so tomorrow morning, keep an eye out for your email. That will come with the links to watch the webinar. Also, there'll be links in there to sign up for next week's webinar as well too. So I have one next week and the week after. I hope you found this helpful, and if you do, I hope you'll invite friends to start showing up or people that you think would benefit that have Lyme too. All right. Good night, everyone. Thanks for being here. I'm sorry I've got to quit a little bit earlier, but I'm starting to lose my voice here. All right. Good night.